I was introduced to it about a year and a half ago from Dr. Weiss. And as soon as it was available to be used here in the States, I got my box fulls of Infinix and the primer and a bonding agent. And that's I don't know, maybe 6 months ago. I'm not quite sure. But we use it in my practice. We like it. There's a lot of pluses, and the biggest thing that we like about it for all the docs that are doing DME, which is deep margin elevation, this has got to be the absolute best product ever to use for that. Because in the DME world, one of the things was, sure, you can go subgingival, but how do you keep the bacteria and at bay, and is it going to work, and things of that nature. So we use it for that because we're a pretty heavy crown and bridge practice, as well as a lot of implants. And just knowing that the product, the composite, as well as the bonding agent and primer, both have the antibacterial, or proximicidal, as we call it. It's just got to be the best thing going.